Great. We'll get started. Thank you very much for joining us this afternoon. My name is Tina Tebow, and I'm the Director of Media Relations for the province of Nova Scotia. Joining us today is Dr. Robert Strang. Dr. Strang will say a few words before he begins taking questions. Again, he will take questions from the room first, and we have a couple of reporters joining us on the phone lines, so we will go to the phones as well. Dr. Strang?
Thank you, Tina. Good afternoon, everybody. So on Friday, we said this was a rapidly evolving situation and information may change. And here we are again today with updated advice for travelers, and this is advice for across the country. So we have been focused on people traveling to certain affected countries. But now we're saying we as public health across the country, anybody who has traveled outside of Canada in the last 14 days may have been exposed to the virus that causes the illness COVID-19. And that's a fact of just such rapid and increasing global spread. So if you've traveled outside of Canada, you may have been exposed. So what we're asking all Canadians, and this information has been given to them at both airport and land borders when they enter into the country, we're saying that if you traveled outside of Canada in the last 14 days, you need to closely monitor your health for the 14-day period when you return. And we're also asking people, certainly Nova Scotians, if they're in that situation, to go an extra step and to minimize their contact with people who are at the greatest risk of getting severe disease. So even though they themselves may be well in the 14-day period, we're saying minimize your contact with people who are older, and especially those who are older and have chronic conditions. So an example of that is, and you'll see in your package of a sign that we're sending out to long-term care facilities to use to say, in that 14-day period, even though you're healthy, do not come and visit in a long-term care facility. We need to do everything we can do to prevent the introduction of this virus into a long-term care facility setting. The second step is then if people in that 14-day period, if they begin to feel unwell, we're saying then you need to isolate yourself at home. If they do then go on to develop fever or a new cough, then they are to phone 811. 811 will then do an assessment on their teletriage and then direct people, if appropriate, to their nearest COVID-19 testing center. The Nova Scotia Health Authority has been working rapidly in the last 3 days, and I do want to thank my colleagues in the Health Authority and at EHS and 811 for their tremendous work under very tight time pressures. Starting tomorrow, they are standing up these locations outside of emergency rooms. They still will be maybe in hospitals, but they're outside of emergency rooms where people will be directed to go if they need testing for COVID-19. So it's important that people call 811 because 811 will have the specific information for the specific community they're calling from. But it's also important that people remember that this will place a significant burden of calls on 811. And in the very short term, while 811 is building their capacity, there may well be an increase in wait time for calls to 811. So the public needs to understand that short-term issue. We are also asking folks who are the Nova Scotians who are currently, there are a lot of people calling 811 just for information on COVID-19. If you are just looking for information, please go to the government website or call the federal government 1-800 number, and both of those, the web link and the 1-800 number is in the media release. It's really important that we preserve 811 for people who have traveled recently and who have not just any symptoms, but were people who have fever or new cough. Certainly, if there's other health questions, other concerns other than about COVID-19, please use 811. But if it's for COVID-19, please, Nova Scotians, only call 811 if you've had recent travel and you have cough or fever or new cough. That's really important. You can go to other places to get general information around COVID-19. So this is up and going there as of today, and as I said, Nova Scotia Health Authority is standing up these alternative COVID-19 testing sites as of tomorrow. I'll shift a little bit now. I know I'm certainly getting lots of questions. My office is getting tons of phone calls. March break, what's happening with traveling? So I think it's important to remember that with these the new guidance on travel, that if people now have plans to travel outside of Canada for March break, they're now going to be dealing with these potential restrictions if they become ill when they come back to Canada. So we're not saying people, individuals, families ultimately have to make their own decision, but they need to be aware of this new guidance for returning travelers. I would encourage people to look at the federal government website because they have specific information there for people who are considering traveling outside of Canada based on COVID-19 or other situations around the world. But we also have to, if people do choose to travel, when you're traveling is a really important time to be extra careful with personal protective measures such as hand washing, trying to minimize face-to-face contact, making sure the surfaces in front of you on the plane, for example, are clean. Today, the Public Health Agency of Canada did come out with advice to Canadians that at this point of time, they're recommending against traveling on a cruise ship. Because we know that being on a cruise ship right now is a setting that is a significant increased risk for getting COVID-19 and how then we have to manage that, and people may be quarantined for a significant period of time on a ship. So the recommendation from the federal government, and there's to fully understand and support the public health rationale for that, is at this point in time, we were recommending Canadians not to embark on a cruise. So that's the kind of advice for, I know, there's lots of implications for that and lots of implications for people with their March break plan, but I want to make sure that Nova Scotians are making those plans well informed of the information that's out there and what they may face when they come back into the country, but also how they may choose to keep themselves, increase the ability to prevent them being infected if they do choose to travel. I also know that we're making recommendations today about people traveling outside of Canada. At this point in time, even in British Columbia, there isn't any solid evidence of community-based transmission of this virus. That is likely to change. And so at some time in the near future, we may well be coming back and saying we have advice for people who travel within Canada outside of Nova Scotia. So this, as I said at the outset, this is rapidly evolving, but today we're talking about people traveling outside of the country. The last piece is, I think this is really important for Nova Scotians, an opportunity again to remind how do we protect ourselves collectively? As I said on Friday, good hand washing, trying to minimize touching your face, especially with unwashed hands, cough etiquette, trying to, making sure we're working together to have what I call the high-touch surfaces well cleaned, minimizing close face-to-face contact with people, trying to start to what we call social distancing, decreasing your close contact with people. People may want to consider even going to an elbow tap or a foot tap from people rather than handshakes. Think about how many people you want to congregate in a small location. And how you're, even if you have people coming together, how you're enhancing making sure people are washing their hands. All those are things we can do now to be better prepared for the likelihood the virus is going to come here. And they also help prevent the spread of other diseases as well. It's also an opportunity to encourage Nova Scotians to think about how we actually care for each other. How do we actually help people who are who are now maybe quarantined at home or are self-isolated? People who are most vulnerable, who actually we want to be less out and about in communities, and how do we support them to be at home? And people who may be sick but don't need to be in a hospital. can we support them as communities? So this is an opportunity for communities to come together to address this issue, and how do we do a better job of protecting each other and supporting each other if and when people even do become ill. Especially important that those most vulnerable are communities. People who are older and those with chronic conditions, we have to be especially vigilant about how do we protect those individuals. I'll take questions.
Dr. Strang, I wonder, given that there's community spread south of the border, what would your advice be to people who don't have to travel to the States, who are thinking about going for, let's say, a weekend trip? Is it the wisest thing to do, given that it hasn't happened that way here, and they may be potentially exposing themselves down there?
So I think that's the advice for people, that you might be exposed, and that I can't. There's lots of factors that go in. People have to make those decisions for themselves, weighing up a lot of different factors. But clearly, traveling outside of Canada, including the U.S. now, does carry with it the possibility or a higher likelihood of being exposed. But it changes so much. Even though there's community spread in the U.S., it doesn't mean that every community is, so that's why relying on the federal government site that has information for travelers outside of Canada, and people are going to have to make some of their own choices. And as I said, if they do choose to travel, what can they do to improve their personal protective measures to minimize the risks to themselves and their families?
Just to be clear, and one of the things you said, one of the first comments about when you should call 811. So if you're feeling symptoms, flu or cold-like symptoms, you call 811. Is there a threshold for those symptoms for you to call or not to call when it comes to COVID-19?
So let's deal with in general. So if there's not concerned about COVID-19, I think 811 is there, and we still need to use it as a resource where people can call. They think they might have some kind of illness going on that they're not sure if they need to go to an emergency room or see a doctor. Absolutely, call 811. But what we're saying, for if you're somebody who's has been outside of the country in the last 14 days, and you now have fever or cough, call 811. But if you're just looking for information about COVID-19, you're either just feeling a little bit unwell, or maybe you're feeling completely fine but you just have questions, please don't call 811 if it's specific for COVID-19. The only thing is, if you're a returning traveler, wait to call 811 if it's related to COVID-19, if and when you develop the fever or new cough.
Can you tell us a bit more about the special stations outside the emergency rooms? Who's staffing those, where they are, and how many there are in the province?
I don't have those details. NSHA is working out the final details of those. They're rolling out some of those sites tomorrow, and they'll be. My understanding is what's coming tomorrow is sites that are based in hospitals, but not the emergency department, and then in the coming days, more community-based sites, and we're also working with EHS around even community paramedics doing home testing. But the first step tomorrow, knowing when we change this advice to travelers, first of all, we need to get testing out of the emergency department, as well as we need to have increased capacity. The quickest thing to do was to find another site in the hospital. All that information is going to be rolled out tomorrow by NSHA. In terms of location, I don't think we necessarily want to get into the public where all these are. The simple thing is the public. If you're traveled and have fever, cough, call 811. 811 will then direct you to the most appropriate site given the community you live in.
My last question is, how many people in the province per week are being tested for this right now? Actually being tested for COVID-19, if any?
I don't have those numbers in front of me. We've had... it's definitely happening. We've had, we have to get you the exact number, less than 30 people, more than 20, less than 30 that have tested, all have been negative. We have had lots of other people come forward that they think they might be tested, and then we've done the screening based on their travel, and said, no, you don't need to be tested. But we are absolutely testing people where appropriate based on travel. This new guidance now, we will undoubtedly have to test more people.
People have been stockpiling stockpiling some goods, and there's been conversations around stockpiling necessary medication. Is that necessary? What should be the protocol?
So I think it's all about taking appropriate steps, appropriate levels of concern without panicking. So I think it's very reasonable that people, as we've heard, buy a few extra groceries that are, canned goods, et cetera, that have the shelf life, in the possibility that you may have to be home for a period of time. But it doesn't mean you have to go out and buy all the toilet paper. It is, and I think people who are on medications for long-term medications, it's entirely reasonable that they make sure that they have refilling their prescriptions now and having a good supply of their prescription medication, simply because there is the possibility in the coming weeks that if we get a lot of respiratory illness here in Nova Scotia, that it's not. We're going to need the health system to deal with that, and it won't necessarily be very easy for people just to get in for instance, a routine prescription refill.
From the Pharmacy Association of the province about potential drug shortages as a result of people going out and getting sort of 90-day additions or renewals of their medication. Is that a concern?
So I haven't had any conversations on that from the Pharmacy Association. So they're one of the, we have to manage this, and this is a fluid situation. So we are going to be reaching out to the Pharmacy Association and bring them into our planning, and we'll have to try to, what's an appropriate way, if that is a real issue, how we manage that.
We'll take one more question before we go to the phone lines.
What would be the plan if there does become a positive test? How would the protocol change for treatment of that?
So the treatment protocol, we have things well established. So we know that this is what the virus is. We know what type of virus is, how it's spread, what the appropriate infection control measures are in place. There is no specific antiviral treatment, so it will be treating somebody, if they need to be hospitalized, it'll be treating somebody with supportive measures that are necessary. If they don't need to be hospitalized, then we will send them home under self-isolation with support from local public health. If you're asking about the notification piece, as we said Friday, we would rapidly know from the lab to my office that when we do have a positive test, and we'd be very quickly communicating that within government as well as out to the public.
We'll go to the phone lines now. Any questions for Dr. Strang from the phone?
Hey, Dr. Strang, Alexa here with Global News. So travel advisories continue to come out day after day, and the latest today is cruise ships are no longer being recommended. Is it safe to say that right now, from a public health perspective, it's not responsible for people to be traveling outside of Canada?
No, I think that's going a bit too far. I think I fully recognize that there's lots of reasons why people may need to travel. There's a lot of factors that have to go in to making that decision. Even though we have global spread of this virus, certainly the risk of getting exposed is very variable if you look around the globe. What we're saying to people is that if you do choose to travel, you could be exposed anywhere, and that is why we're putting the steps in place when people come back, that they're first of all monitoring their health, isolating if they begin to feel unwell, and then with specific symptoms, we need to bring them in to test them.
Alexa, do you have a follow-up question?
Yeah, just given the tight quarters of cruise ships, my understanding is why that environment is particularly risky for the spread of viruses. But when we think about airplanes, for folks on extended air flights, what would be something to keep in mind there, since that is also a close quarter environment?
So I think we have to remember a couple of things. Yet we've got certainly spread on cruise ships. We've had lots and lots of cases of COVID-19 that have been identified after traveling significant lengths from China or other parts of the world, global travel. There have not been any cases of spread within a plane. So that is reassuring that perhaps planes aren't the highest risk environment. As I said earlier, if people do have to travel or choose to travel on a plane, as well as as you go through an airport, those are places where there's an increased likelihood of coming into contact with others who might be infected. So trying to keep your space from people, avoiding close face-to-face contact, really ramping up your hand washing, being very careful where your hands go in terms of railings and all that kind of stuff, and not touching your face. Certainly not before you've washed your hands. And when you're on the plane, pulling down the seat back tray, wiping that down with an alcohol wipe. All those things will be very helpful in terms of decreasing the chance of exposure.
We'll go back to the phone lines now and take 2 questions from the phones. Do you have any other questions from the phone lines? Hearing none, we'll come back to the room for 2 questions.
Is there already an issue with 811 wait times, and if so, what's the wait time like?
That varies depending on the time, but they generally have a reasonable wait time. I don't have specific details on that. All I'm saying is that, especially in the very short term, while they make this adjustment and we understand what the call volumes might be and what extra supports they may need, there is a possibility of an increased time to hear a call back from 811, and just the public needs to be aware of that, certainly in the very short period as we ramp things up in the health system.
Dr. Strang, when I talked to you on Friday about the IHF World Hockey Championships, you, pardon the pun, skated around the issue, and I think we know why now. Are you able to shed a little more light on what the advice was that you gave that led to that decision?
So I think we just, with this disease around, and we talked about what some of the scenarios might be and what the implications could be, both for the tournament and for the health system here in Nova Scotia. There are other perspectives that were provided from other parts of government that was listened to by Hockey Canada and IHF, and they've made their decision.
You're in agreement with it and believe it's a wise choice to do that?
Well, I think if you look around the world and all the things that are being canceled, we have to really ask ourselves the importance of these events versus what risk are they presenting to further, facilitating the global spread of this virus, and then what does that mean on communities that are hosting this event?
Just one word. We also have mass events, sporting events, other events here, and you kind of hinted again that we may have to adjust our approach. Are we at that point yet where you'll look at, say, something like a Mooseheads hockey game or the lacrosse and recommend against people going, with that kind of thing?
So we're not there yet. That certainly is one of the things that's on the table. And as I said on Friday, we're talking about these kind of issues at a national level and being consistent in our decision making and what would be the triggers that would do that. And it's always going to be about finding a balance, protecting the public by not facilitating transmission of disease, but also knowing closing these events has lots of other non-health related impacts. So we have to work our way through these carefully.
Have you had any conversation with the NHL or anything about this?
I have not had any conversation with the NHL. I'm well aware. I've seen in the media that certainly pro sports are looking at this and how they respond to this, but I don't get to talk to the NHL.
Big event here in the summers, the North American Indigenous Games. Are you in touch with those organizers, and have you advised them in any way?
Yeah, I actually chair the health planning table for this event. We're certainly well aware of this. We have the fortunate luxury that it's a few months down the road, but we clearly have identified it's something we need to keep an active eye on, and how we actually potentially might need to adjust the planning as things go down the road.
Thank you very much for joining us today.